Good evening, everyone, and thank you for joining us for this session of Justice in Action. My name is Cheryl Parker, and I am the Director of the Center for Social Responsibility at Marlene Meyerson, JCC Manhattan. If this is your first time joining us, Justice in Action is a conversation series about the various ways COVID-19 has impacted and exacerbated existing inequities in New York City. It's hosted by New York City Council member Brad Lander and JCC social justice activist in residence Ruth Messenger. Today, they'll be talking about the rising rates of COVID among New York's Orthodox Jewish communities and how that connects to public safety, protesting, social norms, and religious freedoms. Joining us is Jacob Kornbluh, national politics reporter for Jewish Insider, who has been advocating for safe COVID-19 practices in New York's Orthodox communities, and Jackie Bray, Deputy Executive Director of New York City Test and Trace Corps. Thank you to our co-sponsors, New York Jewish Agenda, Romamu, Central Synagogue, B'nai Jeshurun, Avodah, Jewish Theological Seminary, National Council of Jewish Women New York, CBST, SAJ, and Repair the World Harlem and Brooklyn. One final note before we begin. While we are committed to hosting this conversation series, the views and opinions expressed by our panelists do not necessarily reflect the official policy or position of the co-hosts or of the JCC. Ruth and Brad, I'm turning it over to you.
Okay, first of all, welcome to everybody. It's amazing in this heightened moment of ongoing pandemic anxiety and 5 days before an election, when everyone's lives are disrupted in some way or other. We are delighted to have an audience and delighted to have Jackie and Jacob for a very important discussion, which we hope will proceed in as open and thoughtful a way as possible, because it is all of our responsibility to do everything we can in our own communities, in our city and in the country to confront, that's the way I want to put it, the numbers, the pandemic numbers, which are sadly still going up in much of, or almost all of the United States, and figure out what more we need to do to bring those numbers under control. We know it raises issues, and we hope to discuss some of those issues tonight. Brad?
Thank you, Ruth. What I'm feeling at the moment is a little like Roadrunner or maybe Wile E. Coyote after they like run off the cliff, and the legs keep pumping as though that's going to help, even though it's really all momentum at that point. And I think we're going to make it to the other side of the canyon, but I got to admit that like the suspended animation is making me sick to my stomach, and it's a long way down. So. Anyway, that's how I am at the moment. So I'm grateful for to be in community with everybody that's on this call tonight. Thanks everyone for joining. And I feel very lucky because I've had the chance to work with both Jackie Bray and Jacob Kornbluh for several years now. Jacob was actually in my sukkah last year, not this year, but last year. And we and in an interesting set of ways, my job in the city council for the last 10 years, even though I live in Park Slope and represent an awful lot of liberal Jews, more like maybe the typical JCC Manhattan crowd. I also have the blessing to represent ultra Orthodox community, a frum community in Borough Park, which is how I've gotten to know Jacob. And the dynamics between city government and all our communities can be challenging, and certainly the dynamics between city government and the frum community, it has been as well in different ways at different times that we're going to explore tonight. And when it goes in a challenging way, as we'll talk about, things get challenging, but having good partners who try to help build trust, who think of things from both an ethical perspective and a public health perspective, I feel enormously grateful for it. So I just want to say to Jackie and Jacob, thank you for coming. And what we like to do to kick things off is actually like imagine ourselves pre-COVID. So if you guys could each like try to remember back to like who you were before this. And I think in some ways for each of you, it really is an important setup because Jacob, you were already in a kind of translation position between communities in your work. And Jackie, your history of trying to get government to protect people and do challenging things better than it sometimes does them for tenants and for homeless New Yorkers, I think also, is like a prefiguring of the challenges that we've been facing in COVID. So yeah, I wonder if you guys could each just tell us a little about what you did before this madness. Unless Ruth, do you have something else you want to say?
No, that's a great place to start.
Why won't you go first, Jackie? I'll give you the honor.
Sure. Happy to. So my name's Jackie Bray. I'm the Deputy Executive Director right now of the Test and Trace Corps. Although when I showed up at the Office of Emergency Management on March 9th, I was the Director of the Mayor's Office to Protect Tenants, and showed up because it was an all hands on deck moment, and found myself now 8 months in. I haven't gone back to my day job, as I had started to refer to it. I spent the last 4 years, I guess, 5 years, 6 years working in city government. And I was the first deputy commissioner at the Department of Homeless Services, and then the director of the Mayor's Office to Protect Tenants. But before that, I was chief of staff at the National Weather Service. And one of the things I always say is that I'm not a subject matter expert. I have come to now be a COVID expert, but I'm not a subject matter expert. I'm a government manager. I'm a public sector manager. And what I have felt passionately about for a very long time is getting this crazy bureaucracy that we call the public sector, that we call government, whether it's the federal bureaucracy or the state bureaucracy or the city bureaucracy, to work for people, and particularly to work for the most vulnerable. And, you know, I think that most people think about government and they think about the people that set the budget or the people that make policy, but so much of government is just the people who figure out the how. There's a lot of people out there that want to decide the what happens. There's fewer people that are really good at how do you get it done. And so much of my job at the Department of Homeless Services, certainly my job at the Mayor's Office to Protect Tenants, was about, okay, we understand the what. Like, solving homelessness is actually, I know people think it's this incredibly complex problem. Housing solves homelessness. The what is pretty straightforward, but the how is really hard. And so
not enough people pay attention to that. So it's really exciting to have you present yourself that way.
That's right. Not enough people pay attention to that. And so, you know, I care about the what. I have my own set of politics and my own set of grounding in racial justice and economic justice, and sort of a moral ethics that I feel very tied to, but I'm an expert in the how. And so when it came to COVID, you know, in fact, in the beginning, the what was hard. We didn't know the what, but now we know the what, and the how is really hard. And so that's sort of who I am. It's who I was before COVID. It's who I still am during COVID. I'm someone that I take government really seriously. And I take sort of how do you, you know, building the Ferrari is easier than turning the super tanker. And so often in government, what we're doing is trying to turn a super tanker. So I don't know, Brad, was that about, right? Okay, so that's who I am. That's what
Brad, 1 minute before Jacob speaks, a couple of people are writing into the chat about angles of the speakers. So I was guilty of not having the.
I think the problem for Jackie is that because she's on separately for video and audio, that when she's talking, it's showing the viewers her audio screen with just her name. So Cheryl, I don't know if it's possible to spotlight or pin her video screens when she's talking so people can see her.
If it's possible, we'll do it. And if it's not, we won't. Jacob, okay. Please take over.
Thank you. First of all, it's so great to be on a panel with such great people. Obviously, Jackie, this is my first time I'm interacting with you. So I'll include you in that list. But obviously, Ruth, Brad, it's really been an honor to get to know you. I am a constituent of yours. So hopefully you won't punish me if I challenge you.
I think it goes the other way. You're the one that can punish me.
I come from a different background. Obviously, I wasn't born here. I was born in London, in Stamford Hill, grew up in a Hasidic community, went to yeshiva in Israel, came here to the United States. I actually worked as a counter guy in an appetizing. Later on, I had my own pizza store. But
The secrets are coming out now.
yeah, I'm starting to reveal myself. People told me I shouldn't give out all the secrets because I should leave that for my book. But I'm going to share with you because I admire this audience and because I'm amongst friends. I'll give you something to go home with. But I did this out of my free time because I was passionate about politics. I was passionate about the activism, but also mostly about issues that people care about. I came here to America, understand that everyone wants to pursue the American dream, but also that it's very hard sometimes to go through the channels that you want to go through in order to achieve your dreams. I didn't go through the regular path towards where I am right now. I struggled. I come without a degree. My first language is Yiddish. And so 7 years ago, 8 years ago, when the New York City mayoral race opened up, I decided, I was unemployed at the time, and I decided this is a good opportunity for me to use my passion for politics, but also understanding the issues of the Jewish community to actually be on the campaign trail, try and monitor what the candidates are saying, report, do profiles, and ask them the questions that I thought other reporters from mainstream media wouldn't be asking, just because they are not really attuned to what the needs are or what the issues are within the Jewish community. The past 5 years, I've worked for Jewish Insider, which is a national publication. We cater mostly to the Jewish community nationally, but also cover the Middle East, national politics, business, and culture. And before COVID, obviously, we cover in our city plenty that there's always what to talk about, always what to discuss, always what to debate about. When COVID came, I felt that there was a need to be sort of a medium where I provide the information and data that I actually get from government and bring awareness to the issue within the community, knowing the community, talking their language, and not necessarily advocating, because it was in my role as a media, just to present the facts, those facts that were said by scientists, by the experts, but also those measures that the government wanted to implement for people to know what it's all about, why it's important, and how do we do everything in order to save lives, but also to challenge government. When I see some government missteps, when you see a lack of enforcement, you see a lack of understanding certain needs, there has to be someone out there to challenge those in government to do the right thing. And that's where I am at this point.
Okay, so Brad, you're muted for some reason. I'm not sure why, but I think the next question from us to each of you would be to sort of to update your story in terms of the pandemic. So Jackie, you told us that you moved over to a new role, but it would be wonderful to have a kind of presentation of not only what you're doing, but what is the city's intent within the larger scientific intent to do thoughtful tracking and tracing, and how does that work? And then Jacob will ask you what has happened over bringing this information to your community and the ways in which you've tried to do it.
Sure, absolutely. So let's just close that. Okay, so let me say first that the city's response to COVID, I think of it right now in about 3 phases, maybe 4. The first was really March and April, where we were just in emergency response mode. We were laser focused on capacity building for our healthcare system, bed, staff, stuff, right? Or space, staff, stuff, I call it, so we did that. And then in late April, early May, we started to realize that we were through the worst of it, or at least the first wave, the worst of it. And we turned our attention to testing and to tracing. And we really think about that in 3 pillars: test, trace, and take care. And take care is the safe separation of people that have COVID or who came in close contact with folks with COVID. And we were incredibly blessed, I think, really because of, I've been saying this, but I think what New Yorkers did in March and April and May, and throughout the summer, was really the single greatest show of civil solidarity I've ever seen in my life. Everyone was so focused on taking care of each other and doing what we had to do to get that curve down and to really contain the virus. We had tremendous success over the summer. So what we spent the whole summer building, we have a testing team with thousands of employees. We have over 200 testing locations throughout the 5 boroughs. We have dozens of mobile units. We now can throw up block parties, sort of shut down a street and test 500 people in a day. And so we built that test capacity. We built the lab capacity that we needed in the city. I think many people remember the sort of July 4th through July, early August, where you'd go get a test and it would take a week to come back or 2 weeks to come back. Now 2/3 of all the tests performed in the city of New York come back within 48 hours, and the third that don't come back within 72 hours. And that took us all summer to build. But testing, everything starts with testing. Everything starts with understanding who has COVID, who are our cases, who needs the support to separate. And then the second thing we did all summer long is we built a team of contact tracers. We now have 3,926 contact tracers working for our program. Thousands of them work from home. They run a big call center we run, and then we've got about 600 or 700 people that work in person. And that program built over the summer. We started only on the phone, and then we went from the phones to the doors, and then we added calls and in-person visits and SMS text messaging. We started by really focusing on people's close personal contacts, their family, maybe close friends they had seen, and then we expanded in mid-July to focus not only on who you've been in contact with, but where you've been, what facilities have you been in. And then our Take Care program, our isolation program, our safe separation program started. We thought we're going to need thousands of hotel rooms. Well, it turned out New Yorkers had no interest in isolating or quarantining in a hotel, and they wanted support to isolate and quarantine at home. And so we took money out of our hotel rooms and we put it into care packages. So now if you have COVID and you're a participant in our program, or you're a close contact of someone who has COVID and they're a participant and participating in the program, you get a care package on day 2 or 3 of monitoring, and it has masks and hand sanitizer and disinfection wipes. And if you're a case that has a pulse oximeter, which is a tiny little medical device you can use at home to take your oxygen levels of your blood, and it has thermometers. And if you're a contact, it now has an at-home test kit. So we're sending you a test kit to test yourself if you've come in close contact with someone with COVID. And so that all summer long, we were building our testing capacity, standing up more mobile sites, more pop-up sites, getting lab turnaround down to 2 days, and we were building our tracing and our Take Care capacity to be able to get to every case. We now reach over 90% of our cases, over 75% of our cases complete the full interview, and 70% of them give us named contacts. And so that's what we were doing all summer. And towards the middle of the summer, we started doing, and this will be relevant for tonight's conversation, what we were calling hyperlocal responses. The test positivity was so low in the city that we could see these tiny little blips. We could see these statistically significant signals. So we saw one in Tremont, we saw one in Soundview, we saw one in Sunset Park, and we would rapidly respond. We were triggering off of, in Sunset Park, I think it was 9 cases we were triggering off of. And we would send testing resources in and outreach resources, and we'd call the community leaders and we'd say, something is wrong, we're not sure what it is, but you've got to redouble your efforts. More masks, less gathering, more people getting tested. And we started to test out this rapid response over the summer. And then the fall has really, for us, been about 2 things. It's been about responding to significant clusters and significant outbreaks across Orthodox Jewish communities in the city that then sort of spread outside of those communities. And it's been about getting the schools open and keeping the schools open. And really, since September 1st, all we've done, or what we've mostly done, are those 2 things. We've responded to outbreaks, and now we have some outbreaks outside of those initial 4 communities. But we've responded to outbreaks, responded to these clusters, and really focused on getting kids and staff back into the school safely.
Let me push on one question before we go over to Jacob, because I think that was really helpful to get a sense of it. But one other thing I know you've been doing a little of that you didn't talk about there and has not gotten much attention, and it's something that I wish as a city we had put more attention to early and were leaning into, is the kind of culturally responsive outreach, and you could call it enforcement or you could call it community compliance. In the spring, some of us were calling for a kind of public health corps approach, whether that was like people that would be riding the subways or people that would speak the languages of all kinds of folks throughout the city, and not just speak the language, but better understand the community's values and the way it approaches public health and safety issues. And unfortunately, early on, there was kind of a policing approach. Like in the very beginning, there was those days when the police were kind of going out with a pretty heavy-handed approach, and that got pushed back on and stopped. But we didn't in a significant way, and I know your office has done some of this, but we didn't in a significant way stand up something in its place where, like in Prospect Park, when folks are getting too close, there's someone who kind of looks like they're from your neighborhood that says, you know what, like, what are we doing here? And the same in, could be true in Hasidic and Haredi communities and Bangladeshi communities, and that's something
that's critical. We know that that's critical. We know from local work, we know from international work, we know from the school system that if it's go back to the issue that Jackie raised, first of all, if government wants to engage with people in its area, it has to be sensitive to who they are, where they live, what language they speak, who they do or don't trust. And I think that's become a huge issue for probably several different communities, but it's certainly a part of the issue in the Haredi communities.
So let me address that. Let me say two things. So I think actually, Brad, you're getting at two different issues. There was the first issue that you're getting at is, did we have enough culturally appropriate and culturally sensitive staff and outreach across the city? And I think the obvious answer to that is in late August and early September, we didn't, right? And I would be happy we could go through why, what did that look like? Because I actually think that there are interesting lessons to be learned there. When we started hiring in May, we made a commitment that we were going to hire at least 50% of our staff from the most impacted communities. And we set out, and we did. We actually, over 50% of our frontline tracers, so that's 3,900 number, over 50% of that 3,900 number of folks are from the 50 zip codes in the city. There's 170 zip codes in the city. So they're from the 50 zip codes that were hit the hardest. So the first thing is, like, we did actually put a serious focus on having people doing tracing who were from the communities that were that experienced March and April the most intensely. We also brought on, in July, we brought on 38 CBOs. We're now up to 41 CBOs, specifically to do outreach in culturally sensitive ways, and specifically to be from communities and of communities to do outreach. In both of those instances, we absolutely failed to have members of the Orthodox community, members of the Haredi community, Yiddish speakers in our staff and in the org. Now, I will say, organizations didn't apply for the RFP, and we actually spent a tremendous amount of time in August trying to get organizations that represented the communities where we were seeing upticks to come into the fold, and it has taken us until this month to make that happen, not for lack of trying, but that's on us, completely that's on us. One of the things I learned the hard way was we were really focused in May, as we should have been, on the racial disparities. We were incredibly focused on the fear that I think was a totally valid fear, that particularly undocumented immigrant communities and mixed documentation households would be afraid to participate in the tracing program. And we had a blind spot not only to the Orthodox communities, but we also, frankly, like I want to say this well. I'm not going to say this well, I'm sorry. We had a blind spot to like more Republican communities or conservative communities where mask wearing might not be an obvious, like an accepted thing to do. So we have these blind spots. but I do think that they came from a motivation where we were really focused on low-income communities of color and really focused on fears amongst undocumented
Okay, but
workers.
meanwhile, as you're saying, and you're being very straightforward and honest, there's clearly a set of misses with the frum
Yes.
community. So let's let Jacob
Yeah.
talk about it from his point of view. I have no idea what that noise is. Somebody's child.
Sorry, yeah, that's in my house. I apologize.
Okay, that's good. You're allowed to be a dad also. But Jacob, please talk about this from, you were eloquent about the role that you sort of picked up for yourself. What happened with that role as the pandemic hit, as the hotspots have grown in your community? Because we know it hasn't been easy for you, and I'd like to hear it from your point of view.
Well, I would say also, I would separate into three phases. It was this outbreak that came right after New Rochelle, a day after Purim, where there was this outbreak that people didn't expect, meaning to say they expected the virus to arrive in New York, but not so intense and in specific neighborhoods where social distancing is not a practice that they would adapt to within a day or two. Okay, you're talking about large gatherings, weddings, prayer services 3 times a day, especially on Saturday. And it took, first of all, for the city and state about a week or two to adapt to the new situation in terms of encouraging testing wasn't available for the first few weeks, obviously. So you didn't really get a measure of, an accurate sample then of what the rate is, because I believe it was very high. You saw the numbers coming out of Borough Park in early April. There were about 15 to 20 funerals a day. And I think that put the community in a state of shock that they didn't need government at all to encourage them to lock themselves up or to close down the schools. It did take a conference call with the administration officials to encourage the rabbis to take action because this is serious, but it was their initiative to close down the schools, close down the schools, and try and work with government to implement certain measures that would deal with it. But I think that at the time it was a problem because it was already hard hitting. And it took a few weeks until people were aware that, once it's spread, and you get it, and one of the most vulnerable get it, they immediately get sick and get admitted to the hospital. There's nothing that you can do at that point if there's no treatment. It was only the next phase where we went into the summer where the infection rate was actually extremely low. Some people said, okay, it's herd immunity. Some people said the virus just carried away. It moved away from New York. But in mid-March and April, my role at the time was just bring awareness to the issue based on the information I got from city and state officials and what I read and saw from federal experts. But at the time as well, while implementing those restrictions and social distancing measures, there was no enforcement. There was no way of actually stopping people from gathering, or, at some point the governor announced that he'll fine anyone walking in the street without a mask. A week later, he says, no, this is only an encouragement. We won't fine people. This sort of created some confusion where you didn't have access to testing. There was confusion of how dealing with the crisis, and obviously everything getting political, but also a lack of enforcement. Going into the summer, while there was no enforcement because the infection rate was really low and the city was already in a reopening process, that is when government was supposed to step in, do some educate the community who does not understand that this is a serious situation where you have to put aside your religious practices and rituals because this is, would use the Hebrew term pikuach nefesh, to save lives. That wasn't the case because the infection rate was extremely low. That is when people would have had to be encouraged to actually get tested. Be encouraged that if you get tested and you test positive, even though you were quarantined in mid-March and April, you have to isolate yourself again, not to spread it. And once we arrived at that point of beginning of August, late August, beginning of September, when the mayor came out public with this information, I think at the time, and as Jackie acknowledged, there were some missteps, but the missteps contributed to the anger and frustration that was followed, which is once the mayor announced there's an uptick in cases, number one, the data that was provided showed that this is a very small sample. You cannot base a dramatic uptick in cases based on 155 or 200 cases in a specific zip code, and that specific zip code probably has over 100,000 people. The sample was 155 or 200. So the fact that it wasn't an accurate sample, but also once people were alarmed about the issue, the mayor and the governor stepped in to immediately impose restrictions before people would adapt to it. And I understand for people like me who are wearing masks the entire summer and who are aware of the issues, this was an easy situation to adapt with, because all you needed to do is stop what the process, the reopening process that you went into in the summer months, and just pause for a moment to try and avoid the spread and try to bring down the infection rate. But it takes time, number one, to distribute those masks, to encourage people to wear the masks in the midst of a high holiday season where prayer services are probably the only activity that people engage in. And the city didn't come up with, number one, practical solutions for services, if it's outdoor services, if it's encouraging street closures, tents, mass testing, immediately mass testing, in order to get an accurate sample. And also what you mentioned, Jackie, was a lack of outreach in their own language, okay? Yes, it takes people within the community to actually talk about it, to encourage people that this is not about getting the government off our backs. Getting tested is just to measure whether you're positive or negative. And if you're negative, you know that what you're undertaking is fine. And if you're positive, you should isolate yourself. And the track and trace program is a great program, but I think at the time it was a little too late to suddenly bring in activists, suddenly bring in ambassadors, suddenly bring in influencers, while undertaking measures that made people, you know, all angry and frustrated and thought that the government is here to control them and to declare a war on religion.
So, Jacob, that is helpful.
You know, I want
to. Let me just ask Jacob a question. Well, go ahead.
Well, I was just going to say, you know, I think what Jacob is saying is spot on. But I will say, I want to sort of set the record on two items there. The first was just testing, right? Was there enough testing? The number of testing sites, like per capita in South Brooklyn, is off the charts. There was a tremendous amount of testing infrastructure in South Brooklyn, even in August. And people weren't availing themselves of it. And that's not a knock on people. It's part of our job is to encourage people to be tested and to tell people they have to be tested. But, you know, we then moved our entire mobile fleet, 100% of our mobile fleet moved into these 4 neighborhoods, these 4 outbreaks. And we didn't see testing go up that much. And I think one of the reasons was that people were so skeptical and so worried about case rates. And what finally got testing rates up is when community leaders themselves sort of figured out that there was no way to reduce the red zone or the yellow zone or the orange zone until you got more people tested, because you had to sort of drive the numbers up. So that's the first thing. And then the second thing is, and I know there's this narrative of like that the city didn't trigger fast enough. We first saw a signal in Borough Park on August 16th. It was the first time we saw a signal. And on the 19th, we triggered our response. And so I do think that part of what people saw was the last week of September, you know, sort of September 23rd to October 4th. But our response really triggered August 19th, and then it built. And one of the challenges of COVID, which has been sort of a challenge from the beginning, is when you start a response, at first it looks like it's too much. You look alarmist. And then by the time the sort of virus has caught up, you look late. And so back in late August, we had a ton of people simply not believing us. I remember we released graphs. We literally, we'd never done this before, we released these line graphs of these incredibly small neighborhoods in an effort to try to convince people that this was actually happening. And then by October, people were, you know, the narrative was, you're late. That is, and I say this not as a knock on anyone, I say this because we're going into a time where we're going to see more outbreaks. It may not be in these communities, it'll be in other communities, and we all need to remember that the public health officials are going to sound alarmist, and then they're going to sound late. And that's part of COVID.
Jackie, I hear you. Okay, go ahead, Brad.
Well, Jacob, I want to ask you to, I think that's all really helpful. And I've spent some time pushing, you know, Jackie and her team in our public hearings as well, because I agree, you know, there are a lot of things that we as a city could have done better. And I've also spent a lot of time pushing my own community here in Park Slope to do better on all kinds of things. And I want to first just recognize, you know, you're here as the one ultra-Orthodox Jew on this kind of call of liberal Jews, but I do want to ask you to help us understand what appears to a lot of people on this call and in my community as some resistance, and just help us understand it better. I hear you that some of that for sure is lack of knowledge and information in places where government could have done better to provide it. But I think, you know, obviously, let's just say it out loud, you know, there's some question of how much of this is a more political thing. Trump, unfortunately, really politicized COVID response in a way that has been devastating for the whole country. And lots of people, in my opinion, have died because he politicized non-compliance with mask wearing and social distancing, and he continues to do it all the time. And, you know, Borough Park is a community where a lot higher percentage of people voted for the president than on the Upper West Side or in Park Slope. How much is some of the traditional religious practice? How much is that young men in every community are often knuckleheads? That's certainly true in my community as well. And it's hard to get young men to think that they're not invincible. How much is distrust in government and that relationship made it harder? What is the role, and there's this question in the chat that I'll ask here, what's the role and responsibility of local elected officials in being a bridge between official knowledge and a community? How, you know, what do you, help us understand, you know, the answers to some of those questions.
I want you to give those answers, Jacob, as you can, but I also want us to pay attention to what Jackie said. This pandemic is not going away quickly. Numbers are up all over the country. New York is going to have different hotspots for different reasons. And so far, we have no national leadership. And so within the city and within the city's communities, what more do we need to learn to deal with this well?
So you gave me a lot to address. And
yes, I'm sorry.
I'm going to try because my brain can take just so much. But I'll try to address all those and put them into context. Number one, you have to understand, and Brad, you probably understand it, that when it comes to the ultra-Orthodox Hasidic community, you also, and I'm sorry I'm using this again, you also have to separate them into three groups, where you have this one group that is complying with all the measures. They understand how serious this is. They know to get tested. If they are contacted by the Tracer program, they will answer. They will take the 15-minute or whatever time questionnaire. And if they feel that they have to isolate themselves, they will isolate themselves. There were some rabbis who even announced halachic rulings prohibiting people from actually going to synagogue. And they haven't released them from it yet. Okay, that is one part. The second group which is a majority of the community, where you have to understand also that for them, they overall distrust secular authorities. It goes on education, it goes on government program, on jury duty, on everything, on every level. And so when you come in to this community and you try to bring them awareness to a serious issue, which is a health crisis, number one, they have to understand that these are different times, that, you know, it's not measures undertaken by the government because the governor has decided that this would work for him politically, or that you have to defy the president just because it doesn't look good. You have to actually encourage them to do that because it is saving lives. And I think at that time, March and April, you didn't need to encourage them to understand this is serious. But once it waned, once people were getting out of the hospital, or the infection rate was going down, people were lax, number one, just because you're allowed to get lax when you don't see those numbers, right? When you understand that, you know, you don't see the horrific numbers coming out from the hospital, you know that your relatives who are sick already claim to have immunity or are feeling better. And so once the reopening process started, they just went back to resuming services and so forth, gatherings, weddings. There was obviously a lack of enforcement, also a lack of acknowledgement from government that now is the time to actually bring awareness to the issue and work on these things. When you ask me the question about elected officials and community leaders, I mean, if you look at what's happening in Borough Park and what happened 2 weeks ago, obviously that will give you an example of how the distrust in government goes so far that if you're an elected official, even though you have a yarmulke on your head, you are still seen as someone collaborating with government. You're still seen as someone from outside the community who wants to, you know, be acknowledged by government, who wants to get that applause, who doesn't want to alienate his colleagues in the city council and the state assembly. And therefore, obviously, he'll advocate for social distancing. Obviously, he won't speak out when playgrounds are closed. And that is when the third group comes in, which is that fringe group that, yes, does not believe in science, engages in political activity just because they believe that what the mayor and the governor are doing are just for political reasons, just because they see a president who has encouraged them to for non-compliance, or even if you get sick, you can actually beat the virus even if you're admitted to the hospital within 2 days. So it's fine, get sick. So all these measures are highlighting the problem where a fringe group can actually enter that vacuum, make a lot of noise, and with their non-compliance, the media highlighting that, and the governor and the mayor acting only when it comes to non-compliance, but not focusing on how to educate people or get them to comply, I think that is what contributed to the tension. Again, obviously, you know, you have to also adapt to a new situation where calling up a few selected community leaders, putting them on a conference call, or in the past when you had a photo up with them, this doesn't talk anymore to the community. This is ineffective. And the same way it's ineffective is to talk to the media about this without implementing a plan that goes to the core of the problem, which is trying to find those influencers within the community that can bring awareness to the issue, that encourage people that, you know, regardless of what political party the governor and the mayor are, regardless of how bad government is for their daily lifestyle, they still have to undertake an effort, which is a collective responsibility to save lives. And I hope I answered you on all the questions, and if not, you can do a follow-up.
No, I think you spoke eloquently. I guess, look, this is a challenge in any community, but I'm asking you sort of a very broad question. I love the description of the different groups. What kinds of leadership in the community, or what kinds of liaison leadership from government might help focus people's attention, all three groups, on the public health issues? Because there is a conflict between religious observance and public health that happens in other instances. But if the city, and Jackie's pretty clear about this, so the city wants to save lives, what else do they need to know about working in the community?
I think we've seen already results in recent weeks. I do not have the numbers in front of me. The city hasn't provided the same numbers that they provided at the beginning of this uptick. I would love to see what the rate is right now. I would love to see how much the testing has gone up in terms of numbers, not only percentage-wise, which would give you an accurate sample of what the real rate is. But also I've seen within the community, there's an effort by local institutions, by large congregations to encourage people. Today, I got on WhatsApp a poster of one of the largest Hasidic congregations in Borough Park with times and locations in Yiddish explaining that this is not only an effort to bring down the infection rate, but actually to identify those who are sick, to isolate them, and to protect our most vulnerable. And I think you're starting to see it once the tension sort of, calm down. There's also another part which I think community leaders and elected officials play a big part in this, is to isolate those loud voices who engage in violence, who engage in, in anti-lockdown measures or in advocating for non-compliance, because they really do not represent anyone but themselves. They have an agenda. There's one leader there who has a political motivation, who wants to advance his political career and is encouraged by the large following he has, but he is also not being isolated by elected officials and community leaders. And the same goes with community leaders understanding that now is not the time to control. Now is not the time to say this organization, that organization will take care of it, but it has to come down to the ground. People, influencers that have a voice within the community, that have a day job, but they are serious about it. They can influence public opinion. I think city can work with them if given the right information. If people know that there's rapid testing, that you can go out on the street within 5 minutes, you can locate a clinic and get tested. If somebody cannot get tested, there's a home testing kit that could be sent to them. There are certain measures, and Jackie knows what those are, and I'm pretty sure they upped the production and distribution, but there also has to be an effort to calm down the tension, the political tension, that people don't feel that government is here to control them, that government is here only to implement restrictions, but also to help us all get out from this crisis. Obviously, the ultimate goal is to defeat this crisis, but Ruth, as you mentioned, this ain't going away, and we have to adapt to it, our daily life, while conducting religious services, while doing some sort of gatherings and going on with weddings, because the ultra-Orthodox community is a thriving community. There's weddings every night, but you can try to work with them to limit that, to try and work to implement sort of social distancing, wearing masks and everything. But if they won't feel that they are targeted, that there's an assault on their religious practices, I think together collaboratively, and you have, again, the results show that in recent weeks, there has been more compliance and the rate has gone down. I would love, again, to see that, the number, but my hope is that there's now an understanding that this is a serious issue. This is not going away. And if we can do anything to save lives, then we should consider, even if it doesn't look politically good, and even if that means that we have to treat this or that community differently, because the ultimate goal, again, the collective responsibility of all of us, is to save lives and defeat this virus.
Eloquently said. Jackie, can you respond to that? You don't have to provide numbers on the screen, but I think Jacob is talking about the ways in which he sees some new rapprochements and some change. And it's obviously, we all understand it's not his job alone, and it's certainly not your job alone. But if the two of you getting to know each other and then figuring out ongoing next steps, there's more to do here.
Yeah, I think a couple things to pick up on what Jacob was saying. First of all, on numbers, it's going down, although it's more sort of plateauing than really going down. Jacob is right. We used to provide a sort of very specific numbers, and we've agreed in an effort to tamp down on confusion between us and the state, that the state will be the source of that data for now. So that's why it's not an attempt to not release anything. It's simply that we are conscious that if the city and the state aren't on the same page, it can be confusing for New Yorkers. So I would say it's going down. It is not yet below the state set thresholds for the red zone, and it has been bouncing around. So it's not sort of went down and is now bouncing above that threshold. I think one of the things that we learned, maybe the hard way, but in September, which is I think part of what Jacob is talking about, is that we had to really adjust our tactics depending on what community we were in, and that these communities are really diverse, right? So our experience in Kew Gardens and Rego Park was really different than our experience in Borough Park. Our experience in Gravesend was different than our experience in Borough Park, and in Far Rockaway and in Williamsburg. We had to get on the ground level and really meet people where they are and talk to individual leaders and community members in order to understand the nuances, understand the differences, and then respond. I think that the community in Kew Gardens is a really shining example of a community that as soon as we picked up the phone and called, their elected leadership, their community leadership, their religious leadership said, yikes, help, okay, help, what do we do? How do we get our arms around it? And they moved fast. And so I think there's like real diversity within these neighborhoods, and we need to acknowledge that. One, two, we needed to change some of our tactics. So, in Sunset Park, we had flooded Sunset Park with our own testing sites. We had brought in testing sites, and people came and we tested and we drove the percent positivity in Sunset down by 2/3 when we were there over the course of a month. We set up shops all over Borough Park and Midwood. No one came. And so what we did, that was sort of for 3 weeks. And then what we did around September 20th, we started offering, maybe earlier, maybe the 14th or 15th, we started offering providers who were doctors in this community, urgent cares in this community. We said, do you want our testing machines? So we literally took our rapid testing machines and set up labs at Park Care, at Maimonides FQHC, so not the hospital, but the folks on the ground in the clinic. And because we realized people weren't going to come get tested with us, but they were going to go to the urgent cares they were used to going to. We did a tremendous amount of work. One of the things is you didn't see Crown Heights on a lot of these maps. There was a tremendous amount of work done in the Crown Heights neighborhood with religious leaders and with really courageous, awesome doctors who just got out in front of this thing and put their reputation on the line when we came and said, we're worried about a few outbreaks, we're worried about a concentration of cases. So I would say that from the government side, we've got to be willing to adapt, we've got to be willing to listen and sort of move forward, understanding the really nuanced dynamics on the ground.
Okay,
Jacob,
Brad, go ahead.
Well, Jacob, I want to ask about your personal experience over the last, in the recent days, because I think it's been very inspiring to a lot of us. And I think that you have been a really, tremendous ambassador of the Frum community to the rest of New York City at a time when, array of what people have been seeing in the media and maybe some of our own pre-existing prejudices or different understandings are in our front of mind. That the courage that you showed in those evenings, from I think some of our point of views, the courage you showed by being willing at that New York Jewish Agenda press conference to help put forward the value of Pikuach Nefesh and stand with, a lot of non-Frum rabbis, has been inspirational. And then you've also been a strong defender of the community, as you have been on this call, trying to help people to understand it in really human ways. So. But it's got to have had some really scary moments in a lot of different ways, obviously being subject to physical violence, but you must also, think twice about how your community is going to look at you when you come to the Upper West Side JCC gathering or do the New York Jewish Agenda press conference, which I'll put in the chat if people want to go watch it afterwards. So, it's a few questions. Like one, where does the courage come from? to be, you know, an outspoken voice in your community? And what has that experience been like?
I was brought up by two strong individuals in my community. My father founded Hatzalah services 3 decades ago in England, and my mother was a very strong character. I think I take the character from her, and kudos to the women out there. They are the one who make us strong and guide us the way. But I think, yeah, the fact that, you know, I worked the hard way up the ladder, the fact that I didn't get my job just because somebody offered me the job, or just because I came out of journalism school and I was offered an opportunity to become a journalist and looking to be popular. No, that is not the case. I am really focused. The day after I got attacked, you know, I was focused on my job. I woke up in the morning, I did my morning newsletter, I continued doing my interviews. And so this is what gives me motivation, is that I know that what I'm doing is the right thing. Yes, it's very uncomfortable to get all these hate mails, and I'm pretty sure everyone on this panel gets it on a daily basis based on which community and they're situated in and what they say publicly. But I can take that as long as I don't get physically assaulted on the street, and I can walk the streets of my own neighborhood. And I take courage, really. I take courage by the fact that, number one, there's people out there who really care. People who care not only for my community, but for all individuals. If it's, you know, trying to help, if it's also understanding that, you know, what I'm doing here is actually balancing my job as a reporter, as an objective reporter, as somebody who doesn't really necessarily take an opinion on political matters, to bring awareness to an issue that shouldn't be political, okay? You can be whatever political party affiliated with. You can vote next week, or if you have already voted, for whoever you want. You know, all the issues matter, but right now it's a matter of life and death, and it's about saving lives. And who wants to see their relative or their friend or their one of the most vulnerable in the community pass away just because we were not careful, because just we didn't protect them? So I think that gives me courage, understanding that it's not about me, it's not about myself. I don't really need this. Obviously, coming together as one community to bring awareness to an issue is very important, and therefore should not be, you know, shouldn't be limited by boundaries. We should all want to do that. But yes, it is a tough job to do. And what I can take a comfort is that I spoke the truth, and I continue to speak the truth about missteps that are being taken within the community, about things that need to be reformed within our community in order for us to thrive and to give a better future for our children and for the next generations to come, but also to bring some of those challenges to the steps of City Hall and government, to understand that sometimes it's the approach. Sometimes it's not about having the resources, but actually allocating those resources to the right place in the right time and equitable. And also understanding that sometimes it goes to the top. Sometimes it's not only the great work that Jackie and her staff is doing, or others within the city who are, again, I commend, and I think that it's important that the information that you provided me, it gives me something to work with to understand of how the city worked during this crisis, but also goes to the top. And when the mayor and governor engage in certain political rhetoric, whether they were right or wrong to be frustrated or to voice their frustration, it happened to be that they, with their statements, singled out a community who was spotlighted afterwards. And then those loud voices, those voices who do not represent the community, got elevated, got the attention. And right now we are only talking about the anti-lockdown activists and not those who are working within the community for the past few months to bring awareness, to encourage people to actually comply with a complex issue. And lastly, I would say, it gives me comfort that we are understanding right now that, you know, there are some lessons to be learned. We right now have the time to take those lessons learned and take them forward. Understand that, you know, you don't necessarily have to look at the past, but to the future. And the steps going forward, I think, should involve everyone, community leaders, but also people on the ground. If it's members of the media, if it's communal, civic, clergies, rabbis, self-appointed or self-acclaimed leaders, whatever it takes, there should be a united effort on this front. And hopefully this will open a conversation and dialogue for other issues that are important for all of us.
All right, look, Jacob, that was one of the most eloquent speeches I've heard in a long time. I do want to say to both Jacob and Jackie, there's some questions in the chat that we don't have time to get to, but I think many of them are areas in which you are already working. I think there's more to talk about in terms of some of what Jacob just said, how the community goes and styles its next round of weddings and services so they are safe. But I want to say, folks, you just heard two eloquent pieces of Jacob's argument. One is, how does anybody in a position of a power or authority work with a full community? It's what the lawyer Brian Stevenson calls getting proximate. How do you get close to the people really in that community so you know all the people who speak for that community and you figure out with them how to make change, how to save lives. Jacob just gave a textbook class in how that needs to be done in his community. But I also want to say, and Brad, I'll let you have the final word, but I want to say that what Jacob is doing as an informed member of his community, as he said, stepping outside of his role as a media information provider to really be an advocate for change, has taken a great deal of courage. And this is a profile in moral courage, which is something that we could need to use a great deal more of in communities, in government, locally and nationally. So thank you for modeling that.
Yeah, hear, hear. You know, in a funny way, I think obviously there's been a lot of feelings that New Yorkers may have directed at ultra-Orthodox community in recent weeks and months. It's sort of true towards City Hall as well in a different way. Obviously, that's not exactly a bias, but I want to really appreciate, I think, Jacob and Jackie, both of you, like a willingness to come on here and speak honestly and listen to each other. Like, I feel like if the two of you could have, you know, gotten in a room at one point or a Zoom room and like, this is the kind of partnership around which it's possible to build the relationships that we need. And obviously things are so polarized and, you know, all of us, I think, are so traumatized at this point that it's not hard to understand why other voices get louder and get in our way. So I really appreciate both of you are doing that. And I hope it's what we can build from. And in particular, I guess also, Jacob, then the dynamic between, you know, our frum cousins and the liberal Jews on this call, that's also something that I think there's some opportunity to build. Like, we need to have more spaces within which to ask real questions, try to have some dialogue. Sometimes those questions are going to be hard, but if we can avoid jumping to our stereotypes, which I think we all know exist within our community as well as from the outside to the community as a whole, you know, whatever, that'll be one of the kinds of things we might be able to build out of this time. So I'm really grateful to both of you for giving so much time, and you probably were each on many, many Zooms today already and have long days tomorrow. So it means a lot that you would come on and do this. And there's a lot of good feedback in the chat, and almost everyone has stayed the whole hour, which is a good sign that people are really getting something out of it. And there's already a request to share the recording so other people can hear it as well. So thank you so much to both of you.
Thank you. Thank
Before
you
we
all.
go, can we just do like the 5 things that everyone needs to know about COVID?
Please.
Sort of what
Yeah.
we're doing right now. Is that okay?
Great. Absolutely.
Right.
A good ending.
I want to obviously thank Ruth and Brad for having us on, and thank Jacob for his moral leadership through the fall and what will be a long winter and spring and summer. Okay, so wear a mask even when you're inside. That is not a joke. Stay home when you're sick. You are putting people at danger if you leave your home when you're sick. Keep physical distance. I do want to say there is no safe way to have a wedding. There is no safe way to have a birthday party. There is no safe way to have a Halloween party. It does not exist. We have hit as a nation a new record. France has shut down. Belgium has shut down. Germany is shutting down. Talk about a country that did everything right. There is no safe way to gather indoors with people. And I appreciate how hard that is, but it doesn't exist. There isn't a good way to gather in large numbers outdoors at this point. Wash your hands and get tested. Every New Yorker should be getting tested often. So those are the 5 things we really need everyone to do. People, this is a serious moment. It is a pivot moment for the city and the country in so many ways, but in COVID too, and we should be taking it really seriously.
Okay, Jackie, we will look for a way for the JCC to share that information through its communication networks, as well as what Brad does already. Thank you very much, both of you, for we're getting a lot of positive response in the chat, for your willingness to share, for your bravery, and for your commitment to trying to make this work so that we do save a lot of lives. Thank you, Jacob. Thank you, Jackie. Thank you, Brad.